E4512 was a labor of love, right? It really was 10 years from 2014 to 2024 that we enrolled patients to this trial. And when you think about the ALCHEMIST platform, it offers incredible advantages, right? Especially when ALCHEMIST was started, most practices were not performing molecular testing on early stage lung cancer. So there wasn't really another way to identify these cases that might be ALK positive, where you could study an ALK inhibitor in the adjuvant setting. And when we started this trial, crizotinib, our first FDA-approved ALK inhibitor for lung cancer in the United States, was the only ALK inhibitor that was out there. Now, during those 10 years, a lot changed, right? So molecular testing started being done as standard of care in many places for surgically resecting cases, number one. And number two, ALK inhibitors got better. They became more effective and they became less toxic. And so along the way, alectinib, a later generation ALK inhibitor, gets approved for resected non-small cell lung cancer. And so in a way, I guess we're not totally surprised that crizotinib did not perform as well as alectinib did in the postoperative setting. But the fact that it didn't perform better than observation is very, very important take-home finding. Because the reality is that when you think about all of the different molecular subsets of lung cancer, the MET, the RET, the NTRK, the ROS1, the EGFR, the HER2, and you name it, drugs like alectinib and drugs like osimertinib are among the very best. And those are the ones where we clearly see a benefit in metastatic disease that translates to a benefit in the postoperative setting for early stage disease. I wouldn't be surprised if some of the other targeted therapies that are more modestly performing in metastatic disease than alectinib and osimertinib, and crizotinib falls into that category, if those are studied in the adjuvant setting, then we might also see negative trials where it just doesn't impact disease-free survival.